Good morning, and welcome to the 2016 Global MetaECHO convening. Welcome also to the ECHO movement. When we met for the first time, about 18 months ago, I welcomed you to the ECHO community. 18 months later, it is clear that as a community we have grown, but ECHO has become a movement. What exactly makes us a movement? First of all, we are united behind a goal to touch the lives of 1 billion people by 2025. Second, and even more importantly, we are on the path to achieving that goal. Just look at where we are. Presently, we have 82 hubs in the world connected to several thousand clinics. But we need many, many more, so we have a lot of work to do. But our progress is accelerating. In fact, the pace of replication is nearly doubling every year. We now have more than 200 signed collaborative partnerships with hubs around the world which are going to set up ECHO projects are in various stages of implementation. ECHO is in 12 countries and counting. In addition to our US projects, there are ECHO projects in Canada, in Mexico, Uruguay, Argentina, Brazil, Jamaica, India, Vietnam, Namibia, Ireland, and Northern Ireland. Until recently, all new ECHO hubs had to be trained here in Albuquerque. We now have 7 partner organizations that are acting as super hubs. So what's a super hub? A super hub trains other hubs. They facilitate high-quality, rapid replication of the ECHO model all over the world, and they've already begun their work. We are constantly adding new topics to address in our ECHO clinics. ECHO has now been applied to 45 different disease areas and complex issues around the world. We started with hepatitis C, but now we have tele-ECHO clinics for diabetes, for addiction, mental health, pediatric epilepsy, autism, HIV, tuberculosis, and many non-medical ECHO projects, such as the project in the state of Wyoming and in India to address education, where school teachers are the beneficiaries of this learning. But most of all, we are a movement because of you, each and every one of you. By definition, movements are driven at the ground level by communities doing the real work. And it is the people in this room that have built and fostered the communities that are doing this work every day. What started here in Albuquerque as a project to treat hepatitis C has grown into something much larger. And we are at a tipping point where our collective impact is making change fast, dramatic, transformative change inevitable. We are here today because of you, all of you who have joined us, bringing your energy, your commitment, your expertise, and your deep caring. Without you, there is no ECHO movement. Without you, there is no way we can reach our goal to touch 1 billion lives. So thank you for everything you do, the people who you are, and everything you continue to do. And thank you for being here today. Whether you came from near or from far, you have joined us here today with a lot of effort to keep this movement going. I am continually inspired by the people and friends and organizations that have made this vision a reality, and I want to take a moment to thank our supporters that have made all of this happen. First, to the entire ECHO faculty at the University of New Mexico and staff, thank you for working tirelessly to support this movement. Thank you to Chancellor Roth Vice Chancellor Richard Larson, and all the University of New Mexico Health Sciences Center leadership for their support. Without their support and them nurturing ECHO when it was a little baby, ECHO really had no chance to survive. We have received so much support over the years from so many people and so many organizations. I want to acknowledge some of them. First, I want to acknowledge the GE Foundation. Without their partnership, we could not have fueled the growth of this movement. And we literally would not be here today because they are supporting this MetaECHO convening. I want to thank our other incredible supporters, the Helmsley Charitable Trust, the Robert Wood Johnson Foundation, whose support was critical to igniting this movement, the Vijay and Marie Goradia Trust Foundation that funds our activities in India, the Merck Foundation that is here today, the Bristol Myers Squibb Foundation, and very importantly, the New Mexico Legislature, New Mexico Medicaid, Department of Corrections, Department of Health. We owe our gratitude and appreciation to all of them. Our deepest gratitude also to our federal partners, the US Department of Defense, the Center of Disease Control, Center of Medicare Innovations, Substance Abuse and Mental Health Administration, Health Resources and Services Administration, and the Office of National Drug Control Policy, and to all the other government organizations and other organizations that have supported ECHO and have joined us. Together, we will reach our goal to touch 1 billion lives, and we will transform our healthcare systems nationally and internationally. Thank you to all of you. We have amazing partners here in New Mexico, across the country and around the world. Together, they form our global community of practice, touching more and more lives every day. Thank you. This ambitious goal will, of course, take a lot of effort, a lot of cooperation, and a lot of commitment. I believe that our shared core principles have allowed us to reach where we are today and to impact so many lives. These guiding principles, not the principles for the ECHO model, but these are the guiding principles of the MetaECHO movement, which were generated and affirmed during our last MetaECHO conference, will allow us to continue our growth and reach 1 billion lives. The first and most important principle is the sharing or demonopolization of knowledge. We engage in the free exchange of knowledge and expertise, not for ourselves, but for the good of humanity. This is essential. As we demonopolize knowledge, we enhance care by moving knowledge instead of moving patients. Dr. Don Berwick, who's sitting in the front row here, who you'll soon hear from, identified this as a core principle for improving our healthcare system. I have long admired him, consider him a mentor. We have adopted many of his revolutionary ideas in ECHO. The second principle is mutual respect. We are first and foremost to each other, colleagues and partners, in perhaps what is the most important enterprise of all, to the improvement of the human condition. We honor the contributions of all the different professions that contribute to ECHO's success. The third principle is non-exclusivity. ECHO is not about competition. It is about cooperation. The new knowledge and new best practices we identify through knowledge sharing are not for ourselves. They are not trade secrets. They are for everyone. The need is enormous. We think 6 billion people in the world don't have access to the right knowledge at the right place at the right time. Tens of millions of people die every year without the right knowledge. It is for this reason we want to celebrate the start of new ECHO projects, even in our backyards, and share our knowledge freely with them. It is because of this principle that so many lives have been touched and how we will reach 1 billion lives. fourth principle is the commitment to innovation as we adhere to our core principles. As all of you apply ECHO to diverse situations, for diverse conditions, in diverse geographies, you create new knowledge. Because of your work, ECHO is constantly innovating and constantly improving. We will incorporate these new ideas into ECHO. We will incorporate your new technologies and our processes into ECHO to disseminate knowledge and share best practices as fast as we can. This is what we all want, and we will all share in these innovations with each other. What we won't do is take shortcuts. As we innovate, we will maintain fidelity to the ECHO model and our core principles. This is how we reach 1 billion lives. Fifth, team-based care. We are all in this together. Doctors, nurse practitioners, physician assistants, nurses, social workers, community health workers, and others. There are no stars, there is no hierarchy, only a team of providers working together at maximum capacity to their full human potential to improve patients' lives. We follow the idea, we all teach, and we all learn. Our sixth core principle is mentorship. Commitment to the mentorship relationship is essential because that's where knowledge transfer occurs. I've always mentioned, as I describe ECHO, if you're trying to teach your daughter to drive a car, you cannot do it by giving her lectures on how to drive the car. Complex knowledge transfer occurs through iterative guided practice and mentorship. In ECHO, specialist mentors share their knowledge and expertise with mentee partners and who then go on and eagerly apply this knowledge. In doing so, they create new knowledge themselves. This is how we expand resources and strengthen the healthcare infrastructure of underserved communities. Seventh, we are outcome researchers, and we are committed to data and community-based research to improve patient outcomes. In this way, we will advance evidence-based medicine and help to discover new and emerging best practices. 8, we have a commitment to listening and learning to and from each other. We are receptive to new knowledge created in the field by frontline community providers who are constantly discovering new best practices. We recognize that application of knowledge in diverse situations, in diverse settings, diverse geographies, creates new knowledge. This enriches everyone. Our 9th principle is our commitment to serve. We work hard for the greater good, always putting the welfare of our patients and our partners above our own. And finally, number 10 on the list, ECHO is not just a knowledge network. It is also a social network. We have a lot of evidence that says it produces joy of work. We are a community of practice dedicated to improving people's lives. We are positive and supportive of each other. And we strive to be both kind and empathetic. The great satisfaction that we take both from our work and from doing this work together creates joy. Khalil Gibran, a great Lebanese-American poet and writer from the 19th century and early 20th century, wrote that work is love made visible. I see that so clearly in our work and in our community of practice together. We are indeed fortunate. These are the guiding principles for the ECHO movement. By sticking to these principles, we will reach our goal to reach 1 billion lives, and we will transform healthcare everywhere. And yet, there are challenges to our movement. And it is important to acknowledge these challenges today, One is policy-oriented, and the other is rooted in our own human nature. Our first challenge, and one that we have discussed a great deal, is sustainability. How can the ECHO model sustain itself, independent of foundation funding? This speaks to the need to make ECHO a part of the norm of healthcare in our country and around the world, so that it is recognized and paid for by payers, both private and public. Currently, our healthcare system does not fully recognize the value of getting the right knowledge at the right place at the right time. Yet, if we fail to do that, it is impossible to get the right care at the right place at the right time. And that creates a lot of unnecessary suffering. As I mentioned earlier, 10 to 20 million people die every year, probably, because all over the world, because the right knowledge is not available to them. Medical knowledge is growing exponentially. And best practice is a very high standard. We cannot achieve our goal of outstanding healthcare without mentoring and supporting all members of the healthcare workforce for their entire working lives. And for that to happen, we need new payment systems that reward healthcare organizations engaging in collaborative learning and collaborative care. We've had some encouraging conversations with the Center of Healthcare Strategies, our friends in Princeton, New Jersey, and they will lead an important workshop tomorrow on Medicaid innovations related to ECHO. They have created an 8-state Medicaid collaborative to find new solutions to fund ECHO. Our second and really deeper challenge is the constant battle to overcome our own narrow self-interests. Although ECHO needs financial support, it is fundamentally a model of altruism. Our partners do not put themselves above the movement. Our movement is not about profit. It is not about fame or ownership of intellectual property. It is not about exclusivity. It's about sharing knowledge and expertise for the good of humanity. It's about transparency, openness, and generosity. This is how we choose to do our work. We live in a highly competitive world, and for many, healthcare is a very competitive business. But this is not what ECHO is. We are partners in an enterprise to improve the human condition. We will have setbacks. This is not an enterprise of the faint of heart. It requires great courage. We must be both fearless and unrestrained in our generosity. We must share with abandon. This is not just about tapping into our better selves. It is about tapping into our best selves as individuals and as organizations together. Thank you. Remember, we are trying to touch 1 billion lives. That's like trying to climb Mount Everest. After failing twice to reach the top of Mount Everest, Sir Edmund Hillary told the mountain, "I will come again and conquer you, because as a mountain you cannot grow, but as a human I can." But finally, when Hillary ascended to the summit in 1953, he came to a new realization. It is not the mountain we conquer, but ourselves. That is what we need to do to transform healthcare in this world. We are all in this together, changing the world, on our way to touch 1 billion lives, alleviating pain and making it possible for more and more people on this planet to get the healthcare they need and to lead healthy and productive lives. What a movement to be part of. Thank you, each and every one of you, for your generosity, your courage, and your commitment, and for the privilege you've given me of taking this journey together with you. Thank you.